Hey everybody, thanks for joining me today. Dr. Ross Marcogiani with Turnpaugh Health and another great word of the week. Today's word of the week is going to be pregnancy prep. We're going to talk about what to do for a healthy baby into prep pregnancy. Should we get blood work, and if so, what blood work should we be getting? And then most importantly, what should our nutrition look like during pregnancy? Let's dive in. So pregnancy prep, really important aspects to take here. So the first thing is managing stress levels. Really crucial and important, the amount of research and data associated with growth retardation or various alterations or defects or issues with pregnancy with women who have reported high levels of stress is profound. So we want to make sure we're taking strategies to manage stress. Whether you're doing regular Lamaze class, whether you're doing meditation or yoga, whether you're getting therapy, whether you're partaking in exercise. That's if you're a woman that has been exercising prior to pregnancy. If you're someone who's trying to take on exercise during pregnancy, not the time to do it. I would wait till after delivery. Making sure that we're keeping the baby in a happy position. Really important. This kind of ties into chiropractic care. So there is a technique called the Webster's technique that helps to move the baby into the correct position with the head facing down and the back of the baby up against the spine, so to speak. So Webster's is a technique that's used with some chiropractors who prevent breech baby. A breech baby is basically if they're bottom first, they're delivering bottom first. Also, you can have a transverse baby, so the baby is laying long ways across the belly. So if this is the belly, head's here, feet are here. Transverse baby would be looking like this. And then a breech baby, if my palm here is the butt, the breech baby their butt would be down instead of the head being down, which is the correct position for delivery. So Webster's technique, also a lot of research supporting acupuncture and craniosacral therapy in improving blood flow and delivery of nutrition to the baby. We want to make sure we're being aware of toxic exposure. So a lot of what the mom is breathing in, those chemicals, can be transferred through the cord blood into the baby. There's a really interesting study done out there. I don't remember all the specifics of it, but they basically had people wear a pack that simulated a pregnancy. And with this pack, they carried it around for X amount of time, and they were able to correlate and simulate a similar aspect if you were to carry a baby and hold a baby in the womb. And the amount of toxic exposure level that they found that accumulated was astronomical. So there's a clear connection that if you're exposing yourself to a lot of fumes, a lot of gas, you're cooking with plastic Tupperware, you're around newer homes where it's producing a lot of off-gassing of these new products, you're consuming or you're using like non-stick Teflon pans, if you're around a lot of gasoline for some reason or using lead-based paints or other toxic chemicals, just want to be super aware what you're exposing yourself to. And being aware of those first 8 weeks. That's the crucial time period where the majority of the central nervous system, the brain, some of these crucial developments occur in the first 8 weeks. And a lot of OBGs will say if you can get past the first 8 weeks with any abnormality or defects, you're way ahead of the risk analysis, so to speak. And then obviously we want to make sure we're maintaining our checkups, that you're checking in with your OBG, making sure everything's in good health there and that the baby is growing well. So in regards to that 8-week period. You can see here on this chart the 38-week gestational period, and you can see the first 8 weeks here is when we have the majority of the central nervous system that's being developed. We have the majority of the heart that's being developed, the majority of your arms and legs, so your extremities, the majority of the ears are being developed. You can see the eyes, teeth, the palate, which is the mouth, and the external genitalia are a little bit what we would call second trimester or later in the pregnancy. So really important to just realize those first 8 weeks are crucial in the development of your baby. Next, about blood work. Should we be doing blood work? Yes, I would recommend to at least get blood work done at least once during pregnancy, making sure we're checking levels of iron, your vitamin D, your various B vitamins, making sure your omega levels are checked. A lot of women can check their HCG, their human chorionic gonadotropin. This is typically what is being measured when you pee on the stick that indicates pregnancy level, but also the amount of this level can indicate where you are at in your pregnancy. So that's important to know. Looking at sex hormones and adrenal hormones are important, making sure that we have adequate hormone levels, which will be a little bit out of range from typical because yes, you are pregnant, but it is still important to look at those adrenal hormones and making sure your stress hormones are in appropriate levels here. Really important when looking at your blood sugar levels. We want to make sure you're not at risk for gestational diabetes. I think it's important if you're someone who has already been avoiding foods or your nutrition is pretty clean, during pregnancy, doing a food allergy test to see if you're stimulating any antibodies that could actually be transmitted to the fetus, or if there's any foods that you're risking that is causing you to stimulate a antibody response. It's helpful to try and avoid those during pregnancy. And obviously making sure you're taking your blood pressure regularly, that's really important. So nutrition, really important here. So again, sticking to a paleo template where we're consuming a lot of vegetation, good color of the rainbow veggies. I would lead towards a little like Mediterranean paleo where you're consuming majority is lean meats and fish. I know a lot of people are probably concerning about the mercury content and the deposit of mercury to the fetus. So staying away from your larger game fish, so shark, tuna, the other larger fish. Those are the two that come to mind right away. But more importantly, sticking to what's called your SMASH fish, which is an acronym that stands for salmon, your mackerel, your anchovies, your sardines, and your herring. So the SMASH acronym, those are your safer and lowest mercury content fish. And again, really good healthy fats, where you get them from the fish, high in DHA and EPA, which I'm going to talk about DHA in just a second, and consuming lots of good healthy veg and fruit that are high in antioxidants. Really important for the mom. And we want to make sure we reduce caffeine intake. There has been some pretty significant studies with caffeine and showing that the caffeine can actually decrease maternal blood levels to the fetus. So basically meaning that you can, with some research has showed that increased caffeine levels, decrease the amount of blood that is actually delivered to that fetus. So just being aware of that in regards to caffeine. Obviously, reducing alcohol, which can cause congenital malformations and growth retardation, physically and cognitively. We want to try to avoid your trans fats, which can influence negatively the growth of the baby. Your trans fats would mainly be your hydrogenated oils, some of your vegetable oils, your palm oil, Some other common would be like your popcorn that you're throwing in the microwave. Those can be your higher trans fats. Your margarines, those are also very common. And just being aware of your baked goods as well. You should try to keep them as low as possible. Those are your more common trans fats. Vitamin A, there has been some research with vitamin A in the first 60 days of creating congenital malformations. So, but also on the other hand, if you're too low in vitamin A is very important for structural development and development visually for the eyes. So about 800 micrograms per day has been shown to be a pretty safe dosage, so to speak. And then here's the other aspect: flaxseed. So flaxseed has been shown to be helpful with certain aspects here, but there has been some research that showed increased levels of flaxseed has shown a little bit lower birth rate when delivered. Now it is anecdotal, but I would recommend with some of the research that's showing that just making sure you're not over consuming flaxseed during pregnancy. Even though it can be a healthy fat, just keeping an eye on that and keeping a lower intake. And then we want to make sure we're taking a good prenatal multi. We want a multi that has magnesium, iodine, biotin, pantothenic acid, selenium, magnesium, chromium, molybdenum. These are all really good essential and non-essential elements to be consuming for the baby. There has been some research showed that increasing the magnesium levels through the mother actually decreased risk of hemorrhage and decreased delivery of preterm babies. So helpful consuming magnesium. Chromium is very helpful in regulating blood sugar levels and decreasing the risk of gestational diabetes, which is a major concern in pregnancy. So that's very helpful. Looking at some other supplements that you should be consuming or can at least contemplate consuming, making sure we're having adequate iron levels. That's important, crucial for the development of the baby. Making sure we're looking at B vitamin levels. B vitamins can influence, if they are low, increase the risk of neural tube defects or congenital defects. So neural tube defects basically meaning the neural tube that should develop into the spinal cord may not close completely. So that would be considered like a neural tube defect. You can also look at your omegas. Your omegas are crucial here for the development of the brain, development of the central nervous system, and development visually for the eyes. Mainly your DHA, your EPA is beneficial as well, but that's why your fats in your healthy fishes, consuming healthy fish, is super important to increase your omega-3 levels. Increasing your vitamin D, having adequate vitamin D levels. Researchers showed when vitamin levels are low in pregnancy, increase the risk of neonatal hypocalcemia. So basically low levels of calcium in the baby, which could influence structural development, like bone development. Also, intrauterine growth retardation was seen with low vitamin D levels and increased risk of that. So development or lack thereof development for growth of the baby. Calcium levels are incredibly important in regards to, again, bone, skeletal maturation. Zinc is another really important aspect here, making sure we're consuming zinc that helps with development of the immune function, development of the gut as well, solidifying and closing any intestinal permeability in the gut. Vitamin C is incredibly important here. Vitamin C has been shown to decrease premature placental rupture. Some other tips here: evening primrose has been taken to soften the cervix, so allow the cervix to dilate or prevent C-section. making sure if we end up having a C-section, you want to do a vaginal swab or culture in the baby's mouth. So a lot of the immunity that the baby is getting and developing right away is going through the vagina and having the vaginal secretions actually be consumed by the baby or go into the baby's mouth. And that's where we get established the gut microbiome. So literally the microbiome of the mother and the vagina will be the microbiome. The development is crucial for the microbiome of the baby, which is the baby's gut health. Some research has shown that increasing or delaying the cord clamping by 2 minutes can increase iron delivery to the baby up towards 75 milligrams of iron. Again, iron is very crucial for the development of the baby, preventing various anemias and delivering oxygen as well, because that's how oxygen is bound through the iron. So just for a frame of reference, 75 milligrams for your average weighted baby is roughly 3 months supply. So just waiting 2 minutes could substantially increase iron. And I'm imagining, if you're increasing by iron by 75 milligrams, I can only imagine what other nutrients that you're also delivering during that time as well. Thank you for your time today. Please, if you know anyone that can benefit from this information, please share. I appreciate your time and have a great day.